Hey everyone, Dr. Mary Starr here, the Total Wellness Doc, and I am really excited about this interview today. I'm here today and we are talking about ultrasound with Nicole Evans from Panacea Ultrasound. Here, we're in Dade City right now at Inspire Total Wellness. Some of you have met my good friend Joanne here, who's a nurse practitioner, sees so many people, and you're here on Mondays, right?
Correct.
Okay. So I was very interested in this because Joanne said I needed to meet you and that we were, to kind of understand all of this. I've done thermography. I know the bad things about mammography, but when I was looking at your website, I'm like, oh my gosh, this is for like everything, right?
Correct.
So little history about you. You are 15 years as a sonographer.
Correct.
In ultrasound, and now have your own business, your own machine. Yes. You travel, you work for other doctors, where you travel and do their patients, and then you're here for a lot of people who are self-pay, and who maybe have high deductibles. We have a very high deductible and we don't use our insurance, so it's very beneficial to do this. So talk a little bit about what ultrasound is, and then we'll talk about your website and all the things you serve too.
So ultrasound is using sound waves to see into your body. Essentially, it's not using radiation. It's just radiation-free sound waves that projects an image onto the screen and helps us diagnose a lot of things.
So a lot of people have heard of X-ray, right? And so in chiropractic school, we learned a lot that X-ray only sees bone. Right. You can't see soft tissue.
Oh, yes.
So ultrasound, you can see the soft tissues.
Correct.
Right?
Yeah.
Where mammography has a whole bunch of radiation with it.
Right.
And of course, we're never telling people not to do that, but we're giving you something that it can be an alternative.
Right.
As well as MRIs,
right?
Lots of and CT scans too. Lots of radiation.
Right. So for people that don't want to go through the radiation, also for people with dense breasts, women with dense breasts, which is about half the population. A lot of times mammography can miss cancers that ultrasound can pick up. So it's very good for women with dense breast tissue or people that just don't want radiation. Yeah. It's a very good alternative for that.
So one of the things that I was really impressed with was self-pay. So you go and maybe you haven't met your deductible and you need, you have a blood clot or you suspect you have a blood clot.
Right.
And that sonogram would cost so much money.
Yes.
Even for self-pay, and your rates are like $50 less than anything.
Yes, and that includes the radiologist read as well. So my prices are a lot less expensive than most imaging centers. In fact, all in this area, and hospitals. Hospitals charge hundreds of dollars for that same ultrasound, whereas I charge very little. I went and I called all the imaging centers and I got prices and I priced down from what they have because I'm a self-pay patient and I understand what it's like to be a self-pay patient. Mm-hmm. So I wanted to create a service for my community and that's what I'm trying to do here.
That's awesome. So write this down, Panacea Ultrasound, panaceaultrasound.com, because I want you to walk through and look at all the different services that you provide.
Yeah.
Okay. So I'm on their website right now. Tell us about an abdominal complete exam.
Yeah. So we have a lot of diagnostic scans that we do. So for patients that are having symptoms like abdominal pain, pelvic pain, like for example, abdomen complete can look at your gallbladder. We can check if you have a fatty liver. We can check for an aortic aneurysm. We do kidneys. We can check for kidney stones, hydronephrosis. I do pelvic. We can check to see if you have uterine fibroids, ovarian cysts. We do testicular ultrasounds, just a variety of diagnostic ultrasounds. I also do screening ultrasounds. So diagnostics are people having symptoms. Screenings are just people that want to know if something's going on. So if you want to know if you have atherosclerosis in your carotid, if you have testicular cancer, thyroid cancer, if you just are curious and want to know and want to get screened, I do screenings as well.
So let's talk about that.
Sure.
So say, for example, I have a particular type of cancer that runs in my family, and I want to come in for a screening, and you see something abnormal there, right?
Yes.
So what would a client do next?
So what I do is I send images I work with a radiologist. He interprets the results. He's board certified radiologist. He interprets the results, and he sends the results back to me the next day, and I will send you the results and your doctor the results the next day. So it's a very, very quick turnaround time.
That's awesome. This one, I personally, unfortunately, have had to have a transvaginal when I thought I was miscarrying a couple of times. I have a beautiful daughter today, but going through that was very challenging. So to be in a place where I'm not just a number, of course, Joanne's space is so wonderful for kids and for moms,
definitely,
and all that too. But if that was something that we needed, we could get that on a Monday with you as well.
Absolutely.
Okay.
Yeah.
And then let's talk about pregnant mamas.
Okay.
Yeah. I'm a brand new mama, gonna have a home birth, all of that, or self-pay, using whatever. And I want to hear the baby's heart rate.
Absolutely.
Okay.
So I will give you that reassurance. I will try. But yeah, we do viability, pregnancy ultrasounds to check for viability. And if you want to hear the baby's heartbeat, we do that. If you want to check your dates, I do that. I do up to 13 weeks, so early pregnancies. Unfortunately, I don't do past 13 weeks, but if you want to come in and just for peace of mind, come in and just check to see if everything's okay, I absolutely can help you.
Oh, I love that.
Yeah.
So soft tissue, head and neck, would that be a lot of like the arteries screening?
Soft tissue, head and neck is to check lymph nodes. So say you have a little palpable area or a soft tissue mass. So if say you have a lymph node you're concerned about or a little palpable area that you're wondering, what is that? I can check and see what it is.
That is awesome.
Yeah.
Bladder.
Bladder.
Oh.
Yes.
Recurring bladder infections.
Yeah, so I can see if there's debris in your bladder. I can see if there's bladder stones. Sometimes you can get stones in your bladder. I can see if there's bladder cancer. And then I have you empty your bladder after the scan just to make sure it's emptying and there's not anything stuck in the ureters. So, but yeah.
Awesome. Testicular scrotum.
Yes.
So seeing if there's testicular cancer. Right. I just learned about hydrocele.
Hydrocele, right.
Okay.
Just fluid in the testicles. If you're having some swelling or you have a mass down there, we can check. Sometimes you can get cysts, and sometimes you can get varicose, which is just enlarged dilated vessels down there that can cause pain and infertility problems. So I can check for infertility issues also.
Undescended testes
Right.
as well.
Right.
Okay. Venous Doppler. I have a big varicose vein.
So that's different. Our venous Doppler exams is strictly just to check for a blood clot. So if you're having symptoms, if you're having swelling, if you're having pain, if you're having some hot, warm legs, we can check to see if you have a blood clot.
Okay. Wow, so much. Okay.
Arterial Dopplers to strictly check for the arteries, check for the amount of atherosclerosis in the arteries.
What would one person do if they got that report back then? Change their lifestyle, maybe?
I would leave that up to their doctor.
Okay.
Yeah. Yeah, they'd have to they might have to do that.
I mean, looking at these things, I'm like, this is more valuable than blood work in some sense, right?
Oh, yeah.
To see what really is
absolutely
is going, because blood work is such a moment
we work
in time.
hand in hand, though. Blood work and ultrasounds, yes, it can give you a lot of information. Wow. We do varicose vein testing to check for venous insufficiency. So if you're having varicose veins, we can check to see if you have insufficient valves in your veins.
Yeah. Aorta and aorta screening. Is that for like an abdominal aorta?
Aorta, Yep, an aorta is usually for known aneurysm, just to recheck, or if you're having like a palpable mass or symptoms. Screening is just if you want to know. If you want to know if you have a an aneurysm, we can tell you.
Okay. Awesome. And then of course the breast, diagnostic here. Well, tell me about the thyroid.
Thyroid.
Okay.
Yeah, just to check for masses or nodules on your thyroid.
Mm-hmm. That's so neat.
Yeah, and we can tell if you're, hyper or hypo. You have hypothyroid. There's a way to tell on ultrasound.
So, Nicole, let me ask you. So I had recently gotten some thermography, and I had like nothing going on in my thyroid, and then I had some activity in one side of my breasts and stuff. So what would be the best thing for me? And I have atherosclerosis in my family. I'm 50 years old. Is that like a screening? Is there an overall thing that you would recommend?
Not necessarily. You could do a screening. You could do a thyroid screening just to see if there's anything going on in your thyroid.
Okay. And probably a breast.
And you could do a breast screening as well.
Okay.
Yeah.
Okay. Well, I love how the website is laid out. PanaceaUltrasound.com. You can go under services and you can see all the different screenings that you do, the scans that you offer. The pricing is very, very clear. Oh, you even have a book now.
And there's 5% off your first ultrasound as well.
Oh,
so,
excellent.
Yeah.
Excellent. Well, thank you so much. Is there anything else that you think that the clients should know?
So all exams, unfortunately, in the state of Florida require an order. So that's diagnostic and screening ultrasounds. Fortunately, I work with a provider who is willing to, if you do not have an order from your doctor, Joanne here at the clinic is able to write that order for you at a low cost. I think she charges $25 for that
reasonable
order. So if you do need that order, just get in touch with me and I'll make that happen for you.
That's great. And remember too, everyone, that this is $50 less than. We are in Dade City, Florida. And I know that we have a whole bunch of snowbirds who come down, but some people just come down on vacation and like, hey, let's, come and write it off part of our vacation as well. So I really encourage you to do that. Again, if they book with you or call you, they can connect with Joanne here at Inspire Total Wellness and get all set.
Yeah, just let me know if you need an order, and I can talk to Joanne and we can make it happen to you at the time of your appointment when you come in for your ultrasound.
Awesome. Thank you so much. Bye-bye.